better brain health. So my background is, I'm a farmer, by the way. Luke's there, he's our buddies. He actually farms our farm. I learned how I should have farmed if I would have stayed in farming. But anyhow, I got into medicine. I enjoyed medicine. I loved it a lot. And I actually was in family medicine initially, and then I often tell people that I fell into geriatrics because I started group practice back in 1973. And we had several nursing homes around the area that wanted someone to come to the nursing home. And we said, oh, we're new family doctors. We deliver babies and all that kind of stuff. And we never had any training working with frail older adults in medical school or in residency.
Wait a minute.
Your audio is going over there. Just in case you feel the one.
Let's turn off the one on your belt for now.
I'm really wired here. Is that, would that be a problem?
Yeah, he's broadcasting.
Do you want to let me?
Doug can solve that. We need Doug for that.
Yeah. So I'm on two mics. So the one is for the video, and the other is for this room. So I'll talk loud and slow, and maybe that'll work for now. So anyhow, I just want to mention that because no one in our medical group wanted to care for elderly people in a nursing home, I became the self-appointed geriatrician in our group. And I really fell in love with older adults. One of the things I've noticed over the years is that we had a group practice and we expanded very rapidly over the course of 4 or 5 years to like 3 initially, and so about 6, 7 a couple years later. And one of the things we try to emphasize is that we want everybody to choose a provider, and that's going to be their family doctor. And people would say, look, I don't care, I like you all, I just want a doctor when I want a doctor. So I found that was not true with caring for older adults. Relationships were really important. In fact, I could tell you stories of people that waited till their doctor got back from vacation to get care, and unfortunately several died in the midst of waiting. But it just shows you how, as we get older, we do value relationships a lot more than maybe when we're younger. So I coined the thing that young people want McDonald's medicine and older adults want relationships. So anyhow, I sort of fell into it, and then I did a fellowship in geriatrics, so that up until the end of June, I was caring for about 80 patients in a nursing home, Masonic Village, which is near where I live, who were profoundly impaired cognitively. So much so that they really couldn't speak. So they were essentially, we would call it aphasic, meaning they can't communicate. So most of my interaction was with the so-called healthcare agent, or maybe some of you may know it as POA, power of attorney. And I love that. That was so much fun because I really got to know the resident quite well. And that's so important when you care for elder adults, because a lot of times many of them do experience memory loss as they get older. And in fact, there's a 1% chance, if there are 60 people in this room, that one person, there's at least a 1% chance that one out of the 60-year-olds in a room of 100 people, there's one out of that 100 would have some memory loss. And that doubles every 5 years until we get to 85, which is about 40%. So we see it's becoming a bigger problem. Why? Because people are living longer. 100 years ago, the life expectancy was about 45 to 47 years of age. Now, for men, it's 78, and women, it's about 80. So that's what it is. And so I've gotten a lot of questions from families saying, children particularly with parents in a nursing home saying, gosh, I'm 75, what do I have to do? Do I have to look forward to having memory loss too? And so that's got me stimulated, because in our medical literature, I'd say over the past 5 to 7 years, there's been a ton of stuff that's been actually written up and demonstrating that, in fact, for late onset memory loss, okay, I'm talking about not memory loss at 50 or 40, but late onset, which is the most common type, you can really change that in many cases, not all. So that's what we're going to talk about, okay? How to maintain brain health as we age. So I just have a brief summary here of objectives, and I pretty well summarized that. I want to spend a fair amount of time with Dan Buettner. Has anyone ever heard or read the book Blue Zones? Well, that's a fun book to read, and it's a nice book to read. I don't know what you do on vacation, but it's a nice book to read if you want to just relax. It's easy reading, but Dan Buettner got a ton of money from National Geographic a number of years ago to look at areas throughout the world where people commonly live to be centenarians. That's 100 years of age, okay? And by the way, I should tell you, there's really a lot of Brubakers that get up into their 90s and the hundreds in our community here. We had a Clifton Brubaker that had his 101st birthday just a few months ago, but unfortunately he passed away before he was able to come here, but he was planning to come here. And I know a lot of you have relatives that lived in their 90s, so I think I'm probably preaching to the choir here, but anyhow, it's never hurts to learn. So anyhow, he looked at groups, and that'll be fun to talk about because he's got some great stories, and I'll share that with you. And then there's a lot of other stuff published in my medical literature that you probably don't get in your magazines about stories after stories and data that's been collected both retrospectively going back as well as going forward like 5-10 years and seeing how people's lifestyles affected their brain health. Okay, so that's what we're going to do. And by the way, I just have a quote here I kind of like because I think it's so profound. Farewell to Arms, I'm sure all of you heard of Ernest Hemingway, but this quote I think says it all, and it says the world breaks everyone. In other words, we all have times of losses, times of hurts, times of pain, illness, that type of thing. And afterwards, some are strong at the broken places. But those that will not break, it kills. And I guess I would interpret that as saying that people that can learn from difficult experiences gain wisdom. And wisdom helps you to cope as you get older. But people that can't learn from bad experiences go through life angry, pointing fingers at you're the cause of my problem. If it wouldn't be for you, I would have a different life. That's a person that doesn't break. And that's a person that kills. Anger takes you down. So anyhow, I think it's very profound. And I know Elton Trueblood, if any of you read Elton Trueblood, a Quaker theologian, says the same thing in Christian terms, saying that, you know, those of faith that go through difficult situations and they grow in their spiritual life and grow in their ability to be able to cope with difficult situations are people that are stronger people of faith. So it's the same type of thing, I think, with Ernest Hemingway, although Ernest Hemingway probably was an atheist, I'm not sure, although his parents went to Wheaton College, by the way. Interesting. So I'm going to just run through some of the characteristics that are commonly reported in my literature about people that live successfully as they age. And so high emotional intelligence, cognitive reserve is certainly one. And I guess I define emotional intelligence as wisdom, basically. People that they can... You can be the smartest person in the world and lack emotional intelligence. And I work with those people quite a bit over the years. In fact, in medical school in Philadelphia, the thing that floated around was if you're brilliant and obnoxious, you're head of a department. And unfortunately, that's true. But you know, I have a grandson who has autism, and it makes me more sympathetic to that statement because oftentimes we never heard about autism 20, 40, 50 years ago. And I think a lot of those people were high-functioning autistic people that were brilliant but didn't have the social skills. So I don't think it's just that they were really being obnoxious as much as the fact that that was probably part of the spectrum that was never ever recognized until the last 20 years or so. So important to keep in mind. But the second point is probably the most important thing. If you can just do all those things, you're going to have good health in terms of brain health. Physical activity is by far very, very important, and probably one of the more important ones of all of these here, even though I would say they're equally important in some ways. And you'll find out in the anecdotal stories I show you, the social interaction is extremely important for brain health. Spirituality, in fact, well, I'll talk about that later, but Dan Buettner comes up with some recommendations. One is about how to live a more spiritual life, and also intellectually active. So I think in the past we have always kind of thought, you know, if I keep my mind really busy, that's going to really keep my brain healthy. And by the way, that's true. However, if I would post one against the other, physical activity and brain stimulation, physical trumps it almost all the time. Okay? But I would say you do both, okay? You don't just say, I'm going to do physical things without stimulating your mind. So that's really important. And finally, inherited genes. I used to tell people, this is being facetious, but I say, choose your genes well and you'll live as long as you want to, and you can do whatever you want to. Actually, it's an interesting study showing that people that have good genetic history of people in their families living long oftentimes had a shortened life through accidents. So maybe they were really doing whatever they wanted to. I don't know. Interesting data, though. But I think that's important. And I just want to mention to you that probably 50% of our health, or lack thereof, is related to our genetics. And the data shows it's more about lifestyles. And I'm not surprised because when I was in family medicine, I would care for 3 generations. A farmer who's retired at 88, some mild heart disease, but nothing really bad. And then his son comes along, he farms, but decides he's going to smoke. Before you know it, he had heart disease in his 60s. Grandson comes along, he smoked, drank, and was sedentary, and he had heart disease in his 30s. You get it? It is lifestyle. A lot of it is. So don't minimize that as we think about it. So just a list of things. People that successfully age are people that are willing to have their belief system challenged. I think of things like, remember back 20 years ago, at least in Pennsylvania, we were required to wear seat belts. And boy, there were people saying, not in my life, I'm not wearing a seatbelt. I want to be thrown out of the car because I don't want to burn up in the car. Well, the data just says that's poofy. I mean, it's just not true. That's changing your beliefs. And some people can do it and some people cannot. Smoking's the same way. Smoking, I'm going to smoke until I die. When my time comes, it's going to be there no matter what I do. Did you ever hear that? Yeah. Okay. Re-examine past failures and see them with a greater understanding. The best person I can give you is a person that all of us are connected with probably, and that's Milton Hershey, through the Hershey and Brubakers coming here together. Milton failed 3 times, went belly up 3 times. And in fact, the word in my community, I don't know if it's accurate, but he wanted to settle in the Mount Joy area and start up another candy factory. And people said, not around here. We don't want a failure here. Of course, that's when he went to Dairy County, and of course we know the history. But I think the one thing about Milton that he was smart enough to recognize, and I would call him a right brain kind of guy, creative, and oftentimes these people are very creative in creating like good food, like good candy, that kind of thing. But he lacked the wisdom to how to manage his affairs. And so what really helped Milton Hershey more than anything else is he went to school at McCaskey, and there's a young man there that was in his class who became a lawyer. And they had a really close friendship, and this person, I forget the guy's name, but anyhow, he told Milton, look, if you can allow me to control your profits, I will make you successful. And so what he did is he told Milton, you're going to get a certain percentage, like 10% of the profits, that's for your spending. Because Milton would go over the country and world and buy stuff, including he went to Cuba. I don't know if you know, there's a place in Cuba called Hershey. And he built railroad systems down there because he was smart, like a lot of us would think, well, that's the source of my livelihood, so I want to make sure I can get sugar when I need it. So that's what really helped Milton to be successful. So he learned from his past experiences and failures. So comfortable with the uncertainty, again, I could talk a lot about that, but I see a lot of older adults in their 70s, 80s, and 90s that are just so anxious about life. And I really feel sorry for them, and often depressed. And I just think that never come to terms with going to be dying sometime. I know I gave a talk here recently with a bunch of state workers, and I think I was talking something similar to this, and I was saying, everyone should have a living will. And I said, how many in this group, these are like a couple hundred people, how many have living wills? And I think about maybe 20 hands went up. So my response was, it looks like everybody else thinks they're going to live forever. There was one guy in the back shaking his head. I said, I get it. As a person of faith and a Christian, I understand where you're coming from. So anyhow, uncomfortable uncertainty is still a major problem in our society today, more than it probably ever has been in a long time. And then being positive, I think, is another thing. I know sometimes there's part of me that says that some people are just born with their cup half empty and others are born with their cup half full. I don't know how much that's genetic or not, but I think that for people that particularly that have cups that are half empty, they have to work at it. They have to be willing to want to try to change their values and their lifestyle, because does anyone here love to be around people that have half empty cups? Don't think so. After all, your cup gets half emptied, right? So, it's a thing that's really important, I think, as we mature in our life. So these are, again, just a collection of different I think it's interesting about the alcohol. I was talking to someone just before we came, and they mentioned about someone drinks a couple of shots of alcohol a day, and that's supposed to be good for you. Well, the data really isn't that impressive. There is data showing that a glass of wine, red wine, probably is okay in terms of helping health. But the thing of it is, while that's true in some cultures, it's not true in other cultures. For example, in the Sardinian culture, which we'll talk about a bit later, the average person a male drank a quart of wine a day. Now that's a ton of wine. I was in Japan or China about 10 years ago, and we had some wine over there, and I said maybe it was Chinese wine because it looked about 1% alcohol. It had hardly any in it. But anyhow, they were suggesting because there are so many centenarians in Sardinia that must be one of the things could be alcohol. But when we're going to talk about Loma Linda, are teetotalers. They have lots of longevity too. So I'm not sure the alcohol is that important, but I do think that is important from the standpoint, if you don't touch alcohol or you don't abuse alcohol under 50, it probably won't be a problem for you as you get older. So that's I think, and smoking would be the same. So again, other things, they tend to overlap here. Stable marriage is all about relationships. What kind of relationships do you have with people? I really feel sorry for people that are disconnected with the human society. And again, sorry, part of that may be chronic depression, and we don't know for sure, but it's so unfortunate from the standpoint that when they go through those valleys, who do you connect with? I mean, you've got to connect with someone to help to support you through those difficult times. So it's really sad, and so relationships are so important, and of course, able to learn from your children. You know, one of the things I think children have done more than anything else, as I experienced in my career, was that when smoking was recognized to be very dangerous, I have heard more than one person say that I stopped because my kids said I have to stop. Or my kids said, I cannot come into their house smoking, or even smelling of smoke. So learning from our kids is something we want to remember, that they also gain wisdom if they live correctly, and so we can learn from them as well. And again, some of the things, you know, acting beyond self-interest. Again, I've been impressed in my life. The people that influence me, probably more than anybody else, are people that live a life of giving. And volunteerism, I think, is extremely important. I feel sorry for people that they're retired and they don't know what they're going to do the next day. Or they're retired and they decide to spend all their time dealing with their own needs. Well, one of the most fulfilling life experiences that one could ever have is being able to give and volunteer. And there's a person in the Masonic Village I will never forget. He was in his 90s. He would come into my office. He had macular degeneration. He would put this up like this to his eyes, and he'd read the things he wanted to talk to me about. He was a retired engineer, and he had a very bad heart. And now, if any of you know anything about heart disease besides Glenn here, I know does, and maybe John, his ejection fraction was 18%. That was very bad. That was next thing to dying. Guess what he did up until he died? Pushed wheelchairs around Masonic Village going to and from rehab. And well, I got to tell you one more story. A very humble person. My brother-in-law wanted to go to Harrisburg to see an ophthalmologist. There was a female ophthalmologist there that all the men at Masonic Village like to go to. I wonder why. Well, she treated them really well. She fed them. But anyhow, he was telling my brother-in-law that, look, you go under this bridge here, and then you go up, and take a really sharp to the right. You got to do it right away. You can't go more than a few feet. And my brother said, and by the way, remember I said he had macular degeneration, okay? He said, well, how do you know this? I said, oh, I designed all that. He was an engineer, civil engineer, and he did all that work in Harrisburg 30 years ago, something like that. So that's called humility. And also a person whose life was filled with volunteerism. He was the nicest person you'd want to meet in the street. So to me, I think that's really important. Come to terms, we already talked about a bit about spiritual beliefs. We're going to talk more about that. Again, found to be very important in terms of aging. And I'd say that one of the most important things here also is purpose in life. And I mentioned to it earlier, when you get up out of bed at your 85 years of age, or I'm 73, soon to be 74, and John's right with me because his birthday's in October, right? 43. Yeah. Right. By the way, I should tell you, John was a really close friend of mine growing up. I had no idea he's related to Brubakers until I guess your mother's funeral. I learned about that. Yeah. So anyhow, this is very important too, which we'll get to later. So just again, depression. Depression is very common as you age, and I think it's partly due to the losses that we experience. I mean, I think losing. I never forget my wife's grandfather lived to be 103, but when he was in 102. And when he was about in his 90s, he was a farmer in the Midwest in Illinois, and he said, you know, all these people around here are gone. My friends are all gone. That's a lot of losses. And then on top of that, your wife dies, or your spouse, husband dies, and then maybe you might lose a child from an accident or something, or cancer. And then you can't drive. That's the worst. Think of the losses that occur. So you can understand why depression is common. But that's all the more reason why I think if we can start practicing some of the things that we talked about, my assumption is most of you, if not all, are already doing that. That's so important because you get wisdom from learning from bad experiences and also having a supportive network there. Yeah, I should mention one thing in medicine I feel a little uncomfortable with, that whenever something bad happens, this is more in the past than it is in today's world, but they would come to me and say, hey, I need a nerve pill to give to this daughter because I'm going to tell the daughter about her father just died. And, you know, we want to be good doctors, so we give them a nerve pill, right, to make them feel good. Well, you know, what's wrong with grief? Grief is normal. We all need to experience grief when we go through bad times. So I'm really opposed to medicating people. Now, there are exceptions, of course, but we need support, chaplain support, family support, church support, friend support. That's more important than pills. And so we're really getting away. In fact, there's more data in our medical literature says that anxiolytics or nerve pills, they harm people, and they do, because it often sedates them. And we see a lot more like falls and accidents with being on nerve pills that sedate than anything else. Well, it's like drinking alcohol. I had a patient once who was taking 2 milligrams of Ativan at nighttime, and I know some here know that's a ton of medicine, like 4 or 5 times what you should be taking. And I was trying to explain to her that, you know, this is really dangerous. I said, this is like drinking a lot of alcohol. And it can really sedate you to the point where, let's say you run to the restroom, you can't even stand up stably to be able to get there. And I'll never forget, she came back to me a week later and she was angry. She said, "You called me an alcoholic." I felt like saying, "You're a smart lady, you got it." So I'm going to just run over, this is the Dan Buettner I talked about. So what he did is he looked at communities across the world that had high numbers of centenarians. So for example, in Sardinia, Italy, that's, by the way, an island off the west coast. Before I saw this, I wouldn't have been able to tell you. So in that group of people, they had 1 centenarian for every 350 people in their population. What would you guess ours would be in this country? Well, it's declining. In other words, the numbers are getting shorter. You want to give a stab at it, Glenn? Oh, I thought you were going. Okay. Well, it's 1 per 4,500. So they have 14 times more centenarians in their culture than we have. So what is it that's so special about Loma, about Sardinia and these other groups that Dan Buettner learned about? And he has a lot of anecdotal stories about this that I could share if we had time. So this is a summary of the kinds of things he learned among the Sardinians, that they eat lean and plant-based diet. Well, we all know about that, right? And so that's not it's interesting. They're goat herders, by the way. And these centenarians went to the top of the mountain and hills to goat herd during the daytime and came down at nighttime. That was their life. But they had purpose. That was so important that they had meaning in life because they were providing for their family. Put family first. Again, that was extremely important in the life of the Sardinians. That's an interesting goat's milk. One of the things that's interesting about goats I didn't know before is, well, we know they eat anything, right? And I, in fact, just learned something the other day. I said, how do you, they eat raspberry bushes and wild rose bushes. How do they do it without hurting their mouth? Well, it turns out they only have a lower set of teeth. They have a real thick gum, I guess, in the top that is able, yeah. Does that count like that too? Okay, that explains something. And sheep. Well, anyhow, what's interesting about goats is, in Sardinia, is that they, as you know, they eat pretty much everything. And they have wild curry that grows around there. And what's interesting is they will eat curry, but sheep will not. Well, curry is an antioxidant. And we're learning that antioxidants are probably very important in our diet. And that's why vegetables and fruits are so important, because they have a fair amount of antioxidants. Well, so does curry. And the curry gets into the milk, and they drink goat's milk. So Dan was just saying that it probably is more than just simply the goat. It's really probably the curry that also affects their life. And by the way, antioxidants, for those that don't have a medical background, is that we are learning that what happens as we age is there's inflammation that takes place in our vessels as we age in some people. And we're finding that people that have low antioxidants in their diet, as well as a lot of simple carbohydrates like sugar. I was teasing, he's putting sugar in his coffee this morning. I said, you'll stop doing it after I give this talk. Actually, it's...
Can you explain what you just said, please?
What I just explained, that using simple sugar is really a carbohydrate. And what we're finding is the people that have high amounts of carbos in their diet have more inflammation in their vessels than those that eat more protein and fruits and that type of stuff. So, and that's exactly right. There's more antioxidants in the fruits and vegetables than just simple sugars, okay? So simple, look, you gotta be moderate in all things, okay? There's nothing wrong with it, I just tease.
Simple sugars, can you call the natural sugar the non-refined sugar better?
Well, I mean, I wish I could say it's better, but it's not really. I had a fellow once who's a diabetic, and he'd been coming to me for a while, and then I didn't see him for a while. He's a diabetic, he's on insulin. He He says, I'm really doing well. I said, well, how are your sugars doing? Well, I don't check them anymore. I said, what are you doing? He stopped all sugar and all I have is honey.
Yeah.
I was afraid to tell him you better check your sugar. So, yeah, that's just the kind of diet here they have. And, you know, the other thing is celebration. Respecting elders is something you see in that culture. And other cultures where people live long too, that respectful. In our culture, what do we see about older people? Either the impotence or they have got to go. The lady in the courtroom, you know. I mean, it's not something that's very positive as the society values that we live with today. And then, you know, take a walk is extremely important. And I think wine is sort of plus negative, as I shared earlier. I'm not sure there's a lot of data, except that it does have antioxidants. So if you want antioxidants, you get the red wine. Yes?
Another island next to Sardinia is Sicily.
Mm-hmm.
What's the average age in Sicily?
Well, that's a good question. That's a good question. What's interesting about Sardinia is they're a group of people that supposedly came out of the north during the 10,000-year ice age, and they were very homogeneous and didn't intermarry much at all. And so you do have a sort of like a perfect model here to see what happens if people live a certain way. So they didn't have a lot of, like we have in our society, lots of people come from lots of backgrounds coming in and marrying and intermarrying.
They have good genes then.
Well, and I think, but lifestyle equally is important, yeah. Because it's, again, 50-50, I would say. We can debate that, Glenn, sometime, but who knows? They chose their genes well, right?
Right.
Ken, what's your diagnosis on my condition?
Well, we'll talk about that. We'll talk about that later.
Eating all kinds of vegetables, and
Yeah.
the doctor said vitamin B12 you're lacking.
Yeah. Well, there are conditions where you can see cognitive impairment due to medical problems, and the most common is hypothyroidism. B12 deficiency is also very common, but if it is B12 deficiency, it should be corrected if it's treated. If it's not corrected, then I don't think it's B12 deficiency as the major reason, okay? But we're going to talk about that.
I got shots in the arm.
Right, yeah, that's the way you would do it, yeah. Yep, that's right. Okay, so let's go to Okinawa. That's another group of folks that live to be quite elderly. Okinawa, if you know on your map, is about 800 miles south of Tokyo, Japan, but they're Japanese. And guess what? There's a lot of the same type of stuff. Purpose-driven, you'll see it all the time, it's purpose-driven. Having a reason for living is really important. Again, their plant diet, gardening is important. By the way, gardening in all these groups are very important. So it's interesting. If you haven't started your garden, it's not too late to start gardening, okay? And I hear Glenn's wife thinks he should be enlarging the garden, right? It's too big already. Okay. Okay. Maintain strong social networks. Enjoying sunshine, getting lots of vitamin D. There is some evidence that's being published now in our medical literature showing that even vitamin D deficiency can be attributed to depression, heart disease, and cancer. Now, sometimes you got to be careful about this data because you see one study. I always say you got to see a couple before I can believe it. But it certainly won't hurt you. It used to be told many years ago, too much vitamin D really kills. You have to take tons of vitamin D to hurt you. So that's not a major issue. But sunshine is very good, and it helps get your vitamin D. Again, the positive attitude, which we talked about in Okinawa. So Loma Linda, yeah, that was oh, by the way, Okinawa, I want to tell you one story. He was interviewing a lady during World War II, who lived during World War II. She had 3 sons. And they were told in this island, small island off Okinawa, that when Americans come, they're going to be brutal. You're going to punish you. You're going to be impaired physically, mentally, and they won't kill you. They'll just really punish you bad. And so they told the Okinawa ones, or the people on the small island, that here's a bunch of explosive. When you hear they come, you all go in the cave and light the explosive. That way you'll have a quick, not a suffering death. And so she took her 3 sons, went into the cave, and she just didn't feel right about this. So she grabbed her sons and ran in the cave as far as she could go, and she escaped. Nobody was harmed, but everybody else was killed. So Dan wanted to interview her. And so he started saying, well, what was it like? And she said, look, I don't talk about the past. I got grandchildren, great-grandchildren, great-grandchildren. She was over 100 years of age. And I got to be positive because I love people. So it's like, you know, wanting to talk about the present rather than dwelling on the past. And that's sort of taken Dan Buettner back a bit, but he understood that that's being the glass half full. And that's the person that was able to break and grow from that, as Hemingway quoted. Yes?
I don't know if it's pseudoscience or something like that, but I read
Yeah, I have not heard that, but I know it's not reached our literature. That is true, but that's an interesting thing. Do you know more about than that, other than he says that?
I can bring up the article later, but...
Let me talk to you afterwards. I'd like to see the source.
Sure.
Yeah, interesting, isn't it?
You saw that too.
So the Loma Lindens, again, I think this is pretty much redundant, but I do need to tell an interesting story. So Dan was interviewing a person who's in his high 90s, and he actually was a cardiovascular surgeon in his era, worked at DeBakey down in Houston, Texas for a number of years, who's since died, I think. But anyhow, he was in his backyard putting up a big 8-foot fence around his yard. And he still worked as the first assistant to the cardiovascular surgeon at Loma Linda Medical School and hospital. And he said that he told him, the lead surgeon, that, look, anytime you think I'm not up to stuff, you let me know, because I don't want to be messing things up. Well, apparently he kept coming back because he was doing a good job. But anyhow, Dan found him back there putting his 8-foot fence up. He said, so what are you doing, 95 years of age, putting up this fence? Well, he said, I found out from the local, I was Home Depot, they would do it for me for $4,000. I could save $2,000, so I did it myself. That's why he's living so well.
How about Donald Trump's wall?
Yeah, that's another story. That's for another time, Ben. So, Loma Linda, this is interesting. How many of us eat like a king for breakfast and like a prince for dinner and a pauper for supper? Probably very few of us, right? We work hard during the day and we eat in the evening. But that has some truth to it, I think, in terms of eating. Oh, there's a lot of sayings. For example, in Loma Linda, or in Okinawa, they say you should eat till you're 80% full. So, yeah, man.
All the people in Loma Linda, study are STAs.
Yeah, what Glenn said, that this is really somewhat of a closed population, and that's why it makes a more effective study, because they're Seventh-day Adventists. And you know, I went to, my geriatric training was in Philadelphia, and I worked with a Seventh-day Adventist, and wonderful people. I mean, they don't, like this fellow, he wasn't feeling like it's sin, for example, to drink coffee or wine, but he just had good eating habits, the kind of eating habits we all should have. And many of them are vegetarians, but they don't have to be vegetarians. So it's like a part of their culture.
I think they had the two groups in the study where one was vegetarian and the other was pure vegetarian, and the other
Right.
eggs and milk. And the one pure vegetarian had several years more.
Is that right? Yeah. Well, there are studies showing that if you do certain things, like if you eat nuts, you can live so many more months. If you avoid certain things, you live. I mean, that's all statistical stuff, which is based on data. But you're right, Glenn. There is some stuff out there. But we have to be careful. I guess I always, again, be cautious. I mean, I'm a dairy farmer, basically at heart, and I love milk. I drink it, and I wouldn't say this if no, Luke's a big dairy farmer here, but I just think that sometimes what happens is stuff comes out in the literature, says, oh, you got to stop drinking milk. Oh, you got to stop doing this. And you know, again, be moderate. My goodness, you don't have to be 100% one or the other. And so I tend to have doubt when I.
Cheese, I like cheese, but they say, oh, cheese is the worst thing.
What's interesting is the Sardinians did have cheese because they used it out of goat milk. And so, yeah, yeah, yes.
I was curious if you have looked at any data connecting longevity to intermittent fasting.
Intermittent what?
Intermittent fasting.
Oh, I've not seen anything in my literature. No. Don't know. Interesting question, though. A very good question. Yeah. Okay, let's move on. Get through this stuff here. Costa Rica, yeah. Oh, I got to tell you a story about it. But again, Costa Rica, same thing. What is it? Purpose in life, involved in a faith community. All these groups are involved in faith communities. In fact, interesting, the Okinawans, all the others were Christian-oriented, but the Okinawans were ancestor worshipers. So that was interesting in terms of their spirituality. So, focus on the family, very important. In this case, there was an anecdotal story of a guy who is over 100 years of age. He would take all day Saturday off to go to town, left at like 6 in the morning to go and buy all kinds of groceries to have a big spread for his entire extended family of like 60, 70 people for Sunday noon. And that gave him a lot of purpose in life. Not only to buy it and to provide it, but to see your whole family gather around. I mean, today, our society is very different, right? I told our kids, flap your wings, go wherever you want to. Well, I regret that. We did get one back. We got two back now. We got a third one. Probably won't get back. But anyhow, that's really important, I think. And I do think that we need to relook at that in terms of the importance of family and the importance of being connected with family. Now, we can do it with electronics much more today than we ever have been before. So we need to be mindful of that we need to still stay in contact and have relationships that you can build upon. Okay, so briefly, one other thing I got to, this is a cute story too. So Diana was in Costa Rica, and they said, this lady you got to meet, she's 105 years of age. And so he said, just go to the house and she'll welcome you profusely and all that kind of stuff. So he goes to her house, he knocks, and doesn't hear much other than momentito, senor. And finally it took her about 6 minutes to get the door. And she profusely apologized that it took her so long because she was up in a mango tree picking mangoes at 105. Could you see yourself 105 picking apples? So this just summarizes, how much time do we have, Pam? Oh, 10 minutes. Okay. Well, I'm going to walk through this quickly, but this is a summary of the kinds of things that Don, or that Buettner felt like he learned from his studies of why people live long in some societies. So, yeah, inconvenience yourself. How many of us have a garage door opener? Garage door opener. Get rid of it. Get out and walk and open the door. Shut the door. That's what you call, we don't inconvenience ourselves enough. Or walk stairwells instead of taking elevators. At Masonic Village, we have a person that's really into exercise fitness, and her name's Stacy. So every time I go in an elevator, which I don't do too often, but when I go on, I said, don't tell Stacy I'm on the elevator. So, yeah, inconvenience yourself. Have fun. Keep moving. Walking is so important. By the way, for people that can't walk for like 30 minutes, which is what we would encourage you to do 3 times a week, 5 or 10 minutes is fine, but you can just do it a little bit more frequently during the day. So there's nothing magic about 30 minutes. Just try to get as much time in as possible to walk. And you don't need to run to be healthy. Walking is fine, okay? Or gardening is just as good, if not better. So be mindful of that. Plant a garden. Yeah, I'll talk about that a little later if we don't run out of time. Here's the 80% full thing I talked to you about before. And I know my wife and I, probably my wife works harder than I do, of not trying to bring food in that's not good for you. Or eating too much of that's not good for you, like high calorie stuff. Okay, so be moderate about that. Don't have all kinds of high calorie snack foods around. Have healthy snack foods as much as possible. Okay, this again talks about the limited meat. I don't know how much that's validated. I mean, my feeling is that we know a lot of fat's not good for you, but you know what? I mean, it puts calories on you, but there's more evidence showing that probably high carbs are even worse than fats. And it has to do with, again, the inflammation of the vessels. When you have high carbohydrates, it causes greater inflammation of vessels. Yes?
I didn't see portion control up there.
Well, limit intake of meat, let's say, well, the previous one talked about the 80%, eating 80% to your full. So that'd be portion control, right? Okay. Let's see. Yeah, well, wine, we talked about that. I mean, there is good evidence medically, by the way, for wine. A glass of wine a day would be appropriate for a female, and I don't know why studies validate this, but for men it's 2 glasses a day. Now it's also about body weight too, and men tend to be heavier than women, so that's probably why. But again, I'm convinced there's not enough data to say you got to go home and drink wine. In fact, we bought some wine. I'm not a drinker. I kind of like a little wine maybe once in a while. But I was telling one of our relatives recently, I said, I buy wine, but I forget to drink it. He said, I wish I'd have that problem.
How about apple cider?
Apple cider is good for you, yeah.
We were over in Switzerland, 85, Horgen, Zurich, and that's the first thing they gave us.
Yeah.
Apple squeezing.
Oh yeah, apple cider is good. You bet. So yeah, in personal mission, I think I like that idea, having some sense of mission, purpose in life. Again, I'm being redundant, but this is what Dan's saying. Those that have a sense of purpose in life are the ones that live longer and have healthier brains than those that do not. And to share with somebody else and learning, as we already talked about. I find this interesting. Reduce the noise, be early, meditate. I mean, that's common sense stuff, I guess, isn't it? I mean, if you're late someplace, what do? You drive fast, then you're not safe. So there's a reason why in Florida you go to meals at 4 o'clock in the afternoon rather than 6 o'clock, besides saving money, because you usually have a early bird discount, okay? You don't rush around as much. Let's see, be more involved, explore new traditions. Okay, yeah, Dan, this is interesting. I don't know if he was a person of faith, but he said that when he visited all these groups, faith was really, really important in these groups. And so that's why he says you need to get involved in a faith community and be there at least 8 weeks. Don't go 1 week and say, oh, I can't go there. You go there for 8 weeks. And I would hope that in many people's experiences, they get connected with people. And that's what we talked about, having strong social connections, along with a purpose in life, a spiritual purpose in life. Or spirituality helps you to interpret and understand life, or make sense out of life. At least it does for me. Yes?
Well, I was going to say, I wonder if the faith communities are important because of the social connection, or if there's more to it. And I think you just answered my question.
Yeah,
I
yeah.
think there is more to it.
There's probably more to it. Yeah.
Can you repeat the question?
Oh, my question was, are the faith communities important because of the social connection, or is there more to it? But I think he answered my question that there is more to it than just the
Yeah,
social connection.
yeah. It's a good question, though. Very good question. Okay, I'm going to run by these because we're really getting out of time here. This is all a lot similar to it. So, yeah, here's an interesting study. This is a study where they looked over, this is a retrospective study where they looked at people different ages, and this is women primarily, yeah. So they found out that if you would look at a cohort of women that were physically very active when they were young, like in sports or grew up on a farm where they were really engaged in farming, and then weren't very active the rest of their life, and cohort them with people who were never active, you see less decline in cognition in the ones that were active just when they're during their younger years of life, when you match them up with cohorts that weren't active at all. Then you take women in the midlife, both groups were not very active, but then the one group became active. They decided they wanted to get more involved physically, think it was good for them. Match them up with cohorts that didn't do any increased activity. Same thing happened as you got in the 70s and 80s, less cognitive impairment. And then but it doesn't end there. Even at 65 and older, match them up with those that exercise and those that never did. And those that exercise only start exercising in the 60s, they too had less cognitive impairment as they got older. So that's why we're now understanding that, particularly with Alzheimer's, the late onset is probably related more to lifestyles than it is genetics. Younger dementia, that's totally different. And by the way, I didn't talk about this, but Alzheimer's is not the only memory loss that we deal with. We have vascular memory loss. That's high blood pressure, okay, primarily. And that's something that's very treatable. And you can prolong life and have decreased cognitive impairment if you're treated well from little or like teenager, whenever you were diagnosed, than if you don't treat at all. So there are other conditions too, but they're less frequent than what Alzheimer's is, okay? So, yeah, so this is an interesting study in terms of maintaining brain health. Now, I think I'll just go through this very quickly, but basically there was a prospective study. That means they started now and started going out over periods of time. And they tested everybody at baseline, and then they tracked their cognitive functioning every year or two. I think it was every year, as a matter of fact. There were several people in that group that had some mild memory loss. It showed up in the testing. And now, one of the things that we often see with memory loss is you lose your executive drive. Your executive drive that I must do this today, I must walk for 10 minutes, or I must do this, that's executive drive, or I must get to work a certain time. That often goes when you have mild memory problems. But these people, in spite of the fact that they had some memory problems, they still had the executive drive and driven. And so they look at this person. He changed his lifestyle by increasing daily exercise, gardening, playing cards with friends, collecting mushrooms, reading, discussing the newspaper with friends and relatives. And age 83, his testing improved. And I won't go through the rest, but they're almost identical to that. So it just shows that if you don't lose your executive drive and you want to have a change in your lifestyle, it's never too late. Because 3 people actually were able to improve that. Yes?
Maybe it was the mushroom.
All the above. Although the other ones did a mushroom, so I'm not sure. But I would say that the exercising of collecting the mushrooms is probably what really did it. But you want to be open, that's right. You never say never, right? Let's see. Oh, this is a kind of interesting study here. This is a memory fitness program. So they took a group of people who said they had memory problems. And so they didn't test it, they just went by what they said. And then they people volunteered to either go through a special memory opportunity to stimulate their memory, try to help them memorize things better. And the other group didn't do that. And they matched them up again and showed that those that went through the memory class said they can notice their memory has improved, whereas those that did not said, our memory has not changed at all. We didn't do anything differently as well. So we now know that if we have a person with mild memory loss, getting into classes does help them to remember better. So that's why it's very important. So I'm getting a signal here that I need to close, and I think I'm about done. I just want to see if there's anything else here I want to mention. Oh, this is a fascinating story here. This is a lady in Australia who was told at a very young age, 46, that she has memory loss due to Alzheimer's dementia. And so she decided she was going to go to school. She got more education. She wrote several books. And she's living 20 years later, and they told her she had 7 years to live, still living today. So we see anecdotal stories like this. Now, this is a young person. But again, she changed her lifestyle. And so I guess my plea is that if you're not exercising, you need to start. If you can't walk very far, you just walk a little bit and do a little bit a couple times a day. And try to stay away from fast foods as much as possible. I'd say do it on your birthday, but don't have a birthday every day. So those are the kinds of things that this is the content of what I wanted to say today. And I guess we need to close, so I will close here. I will hang around a little bit for some questions if you have some. Yes?
I have one more thing. Get a Fitbit.
Get a what?
A Fitbit.
Oh, they're handy. You have it.
Monitors what you do.
So, yeah.
The steps, I now park my car in the furthest spot in the parking lot.
Well,
I never did that before.
good for you. He's our role model, okay?